A Nigerian healthcare worker, Adewale Kudabo, accused for sexually assaulting a female patient, has been jailed to 12-month imprisonment. On Wednesday, Kudabo was working as a healthcare worker at York Hospital when the sexual assault offenses happened, as stated by the prosecutor, Henry Fernandez. Judge Alex Menary said Kudabo had abused the trust placed in him as a medical professional. The York and Scarborough Teaching Hospital's NHS Foundation Trust, which runs York Hospital, said it offers its sincere apologies to the victim, adding that Kudabo had left his job at the hospital soon after the offenses. Mr. Fernandez said Kudabo, 47, was allocated to bathe a patient who was in a lot of pain. He said the offenses did not relate to the bathing but what happened afterwards. When finished bathing the patient, Mr. Fernandez said Kudabo leant down and kissed her on the lips. The victim, despite being in considerable pain, was able to move away slightly but could not avoid the kiss, Mr. Fernandez said. She was left in a state of confusion and felt uncomfortable by the incident, he added. Days after the incident, Mr. Fernandez said Kudabo asked the victim if she wanted another bed bath, and again tried to kiss her. The victim attempted to get away, Mr. Fernandez said, but was unable to avoid Kudabo kissing her on the lips for a second time. He said the victim later reported the incident to police. The press reports that the court heard that the offenses had led to the victim suffering with anxiety and experiencing flashbacks to what happened at the hospital with Kudabo. Kudabo, of Count Deberg Terrace in South Bank, York, pleaded guilty to 2 counts of sexual assault on the first day of his trial in April. Judge Menary said the victim had placed her trust in Kudabo and told him, "You abused that trust." He jailed Kudabo for 1 year on Tuesday, June 10th, and said he must serve half of the sentence before he is eligible for release. The judge said the seriousness of the offenses meant only an immediate jail sentence was suitable. Jerry Sodipe, defending, said Kudabo, who has no previous convictions, had shown remorse for his actions. He has held up his hands to say, "Yes, he is guilty, he shouldn't have done that," the defense barrister said. Mr. Sodipe said Kudabo was moved to sympathy due to the pain experienced by the victim and thought he was showing her comfort by kissing her. But Mr. Sodipe said Kudabo accepted his actions were inappropriate and unacceptable. Mr. Sodipe said Kudabo had moved to the UK from Nigeria with his family for work but had now lost his job. The press reported that after the hearing, a York and Scarborough Teaching Hospital's NHS Foundation Trust spokesperson said, "We offer our sincere apologies to the patient affected. Patients should always feel safe and respected while in our care, and we deeply regret that this was not the case. We acted swiftly and decisively, and the individual involved left our employment soon afterwards." The story of Adewale Kudabo serves as a powerful reminder of the sacred trust placed in healthcare professionals and the devastating consequences when that trust is broken. Patients, especially those in vulnerable, painful, or dependent conditions, deserve dignity, safety, and respect. The moment that trust is abused, it not only traumatizes the victim but also undermines public confidence in the entire healthcare system. Subscribe to the White Coat Crimes for more shocking true stories, medical crimes, medical mysteries, and the dark side of healthcare you were never meant to see.